Okay, how's everyone doing right now? I'm on my iPad, so I have to make sure I'm looking at the camera. Right now it is 8:15 p.m. on Saturday, so I'm sure you all are having fun at the football game. Um, so tonight I wanted to come into lab and make a little video about the skull structures. Hopefully it will help you out as you're beginning to study. Um, so here we go. Okay, so the first structure that you need to be aware of, and I'm going to try to make sure I'm showing this clearly. So here, we learned about this a little last time, but this is the ethmoid bone, right? This is the occipital bone back here, and then you have the sphenoid bone in the middle here. So here, the ethmoid bone, if you see, this is the front, the anterior portion of the skull. This part of the ethmoid bone, the flat portion up top, is known as the cribriform plate. And if you have the brain model here, and if you were to, this is the brain, and if you were to place the brain inside, it should fit nice and snug, so it's giving me a little trouble. But if you look right here, you have right up top here, you have the olfactory nerves. So those sit right nicely along the cribriform plate. And it has it's kind of hard to see in this model, but it has very, very tiny foramina. And these are basically small hair-like nerves of the olfactory nerve, poke their way through these holes, and they're just small hairs, and they basically allow us to, they go to our nose, and they allow us to transmit our sense of smell, which I think is super cool. So if we look and if we orient ourselves here, there are 4 passages through the sphenoid bone right here that we need to be able to identify properly. So the first that we should realize, let's see if I can do it here. It's very tricky to position, but the first one that we want to go through is the optic canal. So the optic canal, let's see if I can do this. It's going to be right there. So that's the optic canal. And like a normal canal, it is circular. And let's see if this, you'll see where it comes through. So the optic canal comes through right up top there in the superior portion of the orbit. And it's round and it looks like a tunnel. So the next portion that we want to be able to identify on our skull here is called the superior orbital fissure. It will be right up top here. Let's see if I can do this. It will be right here, this portion, right here, where my pointer is going. And if I stick the pointer through, I have to be very careful. And if I turn this around, so I don't break anything, you will see that it comes up top there. And that is going through remember, this is the superior orbital fissure. And it's superior because there's another fissure in the orbit, but it's the superior of the two. And a fissure, remember, is just a slit through any piece of bone. Okay, so if we go back here, we have to be able to identify the foramen rotundum. So this right here, let me see, that is the foramen rotundum. And if anyone is familiar with rotunda is just a building with a circular entrance. So that would be the foramen rotunda here. Now let's see if we can poke our way through. Do we get anywhere? So you can't really see on this view where it goes through that easily, but looks like it's kind of, it runs through the bottom of the orbit, towards the bottom of the orbit. And the foramen rotunda is also round. Okay, so next, the foramen. Remember, this is the anterior portion up top here. We have the foramen ovale next. So here, this is the foramen ovale here, and it's shaped nice and easily like an oval, right? So let's see. We want to be able to identify the structures not only from the top of the skull looking down, but we want to be able to look at them like this, which is called the inferior view of the skull. So if I'm poking my pointer through, and maybe I'll even use, let me use this this thingy-mabob right here, so you can see where it's going through. So remember, this is the foramen ovale, and this is the inferior view. Okay, so we're moving along quite nicely. Okay, so what you want to be aware of is that there is this right here, it's kind of this pyramidal portion, triangular portion right here, if you kind of can see that, and it's just a chunk of bone, and this is where your ear structures basically sit. And I'm gonna butcher the name on this, but this is also known as the petraeus portion of the skull. So this can help us orient ourselves to the foramen, because it kind of can get confusing, especially with the carotid canal and the internal acoustic meatus. So first one, we will look, remember this is the posterior side of the skull, and if we go up like, oh, I'm sorry. Yep, so this is the, posterior side of the skull, anterior side of the skull, right? Maybe it'll help if I go like this. So, remember this is anterior side, posterior side. So right here on the anterior side, this is known as the carotid canal. So it's here. Trying to give a good view of this. Let's see if I can get this through there. So this is the carotid canal, and this is where it shows up on the inferior portion, or the inferior view. So that's the carotid canal. I'm sorry, I'm gonna pull this back through. So again, we have to orient ourselves. So this is the front of the skull. If we look back, so back down here, remember this is the front of the skull. We said the carotid canal here is on the anterior side of this pyramidal structure, or this triangular structure of bone. If we look posterior, so if we turn around like this, and we go right there, that's known as the internal acoustic meatus. And that helps relay a signal from our, right here, external acoustic meatus, which is where our ear canal is positioned. Okay, so this one's easy right here. This is just known, this whole big open hole here is the foramen magnum, and this is where the spinal cord goes through. And remember, we learned the previous week, this is where our occipital condyles are. So then another structure that you want to be able to identify is the jugular foramen. So if you, let's orient ourselves when we turn up. So this is the front, this is the posterior view. Remember, this is the internal acoustic meatus. So right below, it's kind of hard to see. Kind of, on some angles, it looks like a heart-shaped structure. But this is known as the jugular foramen. And it's posterior to that triangular portion. So this is the jugular foramen. It's in between the temporal and occipital bones. So if we go like this, we can see it comes through right there. So that's the jugular foramen. Okay, so one more structure on the skull that we want to be able to identify really well is known as the hypoglossal canal. So let's orient ourselves. Here are the occipital condyles. If you look inside, let's get a good view. So you see that, let's see if I can. So you see it right here. So that inside, it runs perpendicular to the lateral borders of this foramen magnum. That's known as the hypoglossal canal. Okay, so that should be, and we can, it's a little tricky, but, so hopefully that gives you a good view of all of the foramen of the skull. I hope that was helpful. Now we're gonna move to the cranial nerves. Should be fun. Okay, I'm back again. So we're gonna go through some of the cranial nerves, and I hope this video is helpful in solidifying your understanding of the brain and how amazing it is. Okay, so the first one that we're gonna observe, I gotta get my pointer hand ready. We have the olfactory nerve here, the olfactory nerve, which is number 1. And remember, which we just said earlier, is that its hairs transverse that cribriform plate. And it travels to our nose, and they help relay that sense of smell to our brain so we can process all the wonderful smells that we experience in our daily life. Okay, so next here, boom and boom. Remember, this is the pituitary gland, but here, this is the optic nerve, and it travels through the optic canal to the eye socket, and it's very, very important in our vision, and it's continuous with the retina, which is what helps us see. Okay, so here, okay, let's see if we get a good angle. So these two, right there and there, those are known as, that's number 3, right? That's the oculomotor nerve. Okay, and now if we go next, number 4 here and here, that's the trochlear nerve. Number 5 here, that's the trigeminal nerve. And what's important about the trigeminal nerve, remember, is that it has 3 branches. So not just 1, not just 2, it has 3 branches. And they each innervate different areas. So the first branch passes through the superior orbital fissure. The second branch passes through the foramen rotundum. The third branch here passes through the foramen ovale. Okay, so that was number 5. After 5, we're actually going to come up here. That's going to be number 6, which is abducens. Okay, now next, coming down, this is right here. This is number 7. That's the facial nerve, and this is the vestibulocochlear nerve. Both 7 and 8 here pass through the internal acoustic meatus. If it helps you remember here, the internal acoustic meatus, remember, is posterior to that pyramidal portion of our skull. And remember that pyramidal triangular portion of the skull holds our inner ear structures, and those inner ear structures have consist of the cochlea and the vestibular system, so that might help you remember. So that was 7 and 8. So if we go to 9, this guy, sorry, let's see, I'm gonna get my pointer on it. So that right there is 9. That's the glossopharyngeal nerve. It passes through the jugular foramen and it travels to the tongue. So it's the glosso. Glosso is another word for tongue. And then it's glossopharyngeal. So the pharynx. Not a video, I'll throw a picture. Okay, number 10. Next one down here. That's the vagus. And it's also known as the wandering nerve. And why do you think that is? It's because it wanders throughout our body, going to our abdominal cavity, our thoracic cavity, our pelvic cavity. Okay. 11. These are all known, this collection here. Sorry, let's see if we get a good view. Here and here. This is looking good right here. Let's see. Here and here. Wait. Here. Back here. Back here. So that's known as the accessory nerve. And it innervates muscles of the pharynx and the neck. Okay. So number 9, 10, and 11, the accessory. What's important to know about them is that they play important roles in the neck and beyond. So all three, the glossopharyngeal, the vagus, and the accessory, they all pass through the jugular foramen. Okay, so last but not least, you have number 12 here. Sorry, it's hard to see. Here and here. Let's see if we get a better angle, better view. So that's known as the hypoglossal nerve. And we just learned with the glossopharyngeal that glosso is another word meaning tongue. So if it helps you, hypo, remember, means below. So glossal means tongue. If you put them together, hypoglossal nerve. So it passes through the hypoglossal canal, and it innervates below our tongue. And it helps control the muscles of our tongue, which I think is really cool. So there are a lot of fun acronyms. I know this might be, it might seem like a lot, but there are a lot of fun acronyms to help you remember this all. One thing that I forgot to mention is that number 3, where is it? Where is this guy? Number 3, and number 4, the trochlear, and number 6, where is it? The abducens. They all pass through the superior orbital fissure, and they send motor info to our eyes to help control eye movement. So I hope that video wasn't too long, and I hope it's really helpful for you all. Hope you're having fun at the game. Please let me know if you have any questions. Cool. See ya.